Welcome to RevMD, the podcast all about medical billing. I'm your host, Dr. Heather Signorelli. Join us as we break down the ins and outs of medical billing, discuss the latest trends, and also share insights to help you and your practice navigate the world of healthcare finances. All right, welcome back to another week of the RevMD podcast. I am excited to have Dr. Mitra here with us today to talk about lean practice, to talk about space, and how we really start thinking outside of the box as there is a transition for many physicians that we encounter who are trying to figure out how they can work on their own, either as a solo practitioner or with a smaller group in mind, and kind of some challenges around that and some solutions that Dr. Mitra's new company has for folks. So with that, I'll hand it over to Dr. Mitra to introduce herself and tell us a little bit about her background.
Awesome. Hi, Heather. Thank you so much for having me on the podcast. I truly appreciate it. My name is Mitra Sadhu. I am a nephrologist in Florida and run a lean private practice. And I try to create solutions for my peers in private practice so we may all thrive in a changing healthcare landscape.
Oh, I love it. Okay, so you got to tell me, lean practice. I know I've heard the words, but maybe some of our listeners haven't. So talk to me a little bit about what is a lean practice?
Absolutely. So I will start with my version of a lean practice, and then we'll talk about lean practice in general. I got here because I wanted to work right at the outset. I realized that I wanted to work part-time in order to save my best energy for my kids as well as my patients. And in the beginning, towards the beginning part of my career, I started with a couple of independent contractor gigs that afforded me that flexibility. Then I wanted more. So I interviewed with some groups in town and figured out broadly that there were two routes I could take. I could either work 100 hours a week and go the partnership route down the line, or I could work what they refer to as often as mommy hours and stay that way. Now, I wanted to have my cake and eat it too. I didn't want to have to choose in this day and age between wanting to spend time with my family and wanting to accomplish something at work. And I have an entrepreneurial spirit. Ownership drives me. It motivates me. So I looked into how I could be a practice owner. And if I were to be a practice owner that wanted to work part-time, I was going to have to think outside the box. And that is when I honed in on the two biggest expenses for a small practice, namely office space and personnel or staff. So for the first, I went in and started working out of a shared workspace location. And I did the math, and I knew that with the volume that I wanted to see, that it was going to work. And two, for staff, started off as a micro practice, which means I had no employees or independent contractors or third-party companies helping me out with the practice. I did it I did all of it, from phone calls down to billing and calling insurance companies for denials, and learned a heck lot along the way.
Yes, I'm sure. I can only imagine.
Right. So that is my version of lean. It lets me work part-time and be a practice owner. But lean doesn't have to look like this. You could be a giant practice with many physicians and staff, several locations, bringing in multiple seven figures in revenue, or any size really, and still run lean. Because it is, at the end of the day, a way of thinking. It is the idea that you want to provide value to your client or customer, in this case, our patients, with minimal waste. So it involves defining what values you provide and then looking at your processes with a fine-tooth comb, taking out anything that's unnecessary or unclogging the bottlenecks, putting it to the test, and then reiterating. And we do this with every process, one value at a time, and you have yourself a lean practice. And it's not something you get to. It's not a destination you get to, because it's a process of continuous improvement. The North Star being providing perfect value with zero waste. And that is really the definition of a lean practice.
I love that. And you think about that in relation to any business, right? And you think
That's
about
right.
businesses in general,
Mm-hmm.
right? I mean, a business right in the beginning, right? Whether you have a small cash influx or no cash influx, right? The CEO, the owner, the co-founder, the person who starts the business, and
Mm-hmm.
is really the person who has to wear multiple hats, right? You're, like you said, you're answering the sales emails, you're potentially even building a website, you're the one who's doing so much. And then as you get that first client or that first patient or that first 10 patients, then you're saying to yourself, okay, I have this much capital. What's the first thing I can get off my plate economically? And then you take that step and you say, okay, maybe that's admin, maybe that's phone calls. I think it just depends on what type of business you're in. And so I think this idea that you're building around lean practice is really an idea around multiple businesses. It's this idea that I'm growing slowly, and I'm delegating things. Either it's because I don't like to do that thing, or I can have somebody else do it for less than what it takes my time to do it. I think that's amazing.
100%. You nailed it. And that is exactly what it is all about. And again, it's not being penny wise and pound foolish. You always judge, like you said, how much time it takes you. And if you could see patients or something else in the interim and make more, or if it's something you don't enjoy and would rather outsource and now have the means to do so. In fact, I hired my virtual assistant when I found that I was working evenings and weekends on admin tasks. And I was like, that was not the idea behind this. And so even though I could technically still do all of that, I outsourced it at that point, starting with the tasks that I least enjoyed and then some more. So you got it.
Yeah. I mean, and what do you think in thinking about as you've started up your own practice? Talk to me a little bit, like first with some of the major wins, and then we'll kind of talk a little bit about some of the struggles and how you've come up with a creative solution on the struggles.
Sure. So, major wins, I think, is the realization, and that came about gradually, that I am actually providing the value to my patients exactly the same way, or perhaps even better than I would in a fancy office with lots of staff hovering over me. And I say that because I'm able to spend a bunch of time with my patients, more than is often considered feasible in a traditional insurance based practice. And that's what I am. I'm not cash based, I'm completely and only insurance based. And that gives me so much joy. It lets me, first of all, it is the whole reason why I wanted to do this in the first place, to doctor the way I dreamt of. And to be able to do it, I think, has been a success. And then to find validation from patients and from referring physicians has obviously also really helped. And I want to bring up something. I think, yes, you asked about struggles, if I may touch on that.
Yeah.
I didn't start off this way. I was fairly embarrassed of my practice setup when patients used to ask, "Hey doc, can I ask why you're in this space?" I used to kind of mumble something under my breath, "Oh, I'm starting out, etc., etc." But when I kind of realized that I could not do a better job in a different, just because the space is different, then I showed up differently, and I think it also helped on the other side, patients see the value in what I did.
Well, and I think one of the struggles, right? When you get out of school, you have this vision of what your day is going to look like. And I think all of us
Mhm.
are physicians and maybe professionals in general we like our autonomy. We like our control to a degree.
Yes.
And it kind of goes back to your initial point where you were talking about how you're trying to fit in a career with being a mom and a wife and just being
Mhm.
present in with your friends even. I mean,
Mhm.
whatever you have in life that you want to devote time to. And that has changed over the last 40 years, right? Like that whole idea of work-life balance probably didn't really even exist when at least my mom was working. I mean, it's not that it didn't exist. It wasn't prioritized. I should probably put that differently. But now we know the importance of that, right? Like you get this one life,
Mhm.
you get this one time, this chance to spend
Mhm.
time with your kids and your
Mhm.
friends. And at the end of it, we don't know, we're not guaranteed tomorrow. And so being able to balance how I'm going to spend my time and where I'm going to spend it. And I think that's why we do see so many physicians going out into private practice, but then like you said, struggling to try and figure out, okay, how do I make this work in the confines of how I want to practice so that it does bring me joy, as you say. And so,
That's right.
one of the struggles that I know you struggled with was about space, about staff, about how you figure that out. And so, talk to me a little bit about the struggles when it came to finding a space that worked for you and your practice and your patients. And then that leads me into, what does this look like as you try and solve and help that problem for others?
Absolutely. So when I was starting out, like I said, I was starting off without a patient base. I knew it would take time to build up. I didn't have a professional footprint in my part of town. And so I was looking to sublet space a couple times a week from an established practice in order to make it work, make the math, as they say. And I couldn't find anything. I cold called a couple of practices. The response was at best lukewarm. And then I happened to learn about this co-working space, which is not strictly medical. And so that's where I've been. And a strong, vocal uh, champion for private practice for the same, many of the same reasons that you just brought up. The autonomy really matters to us because, and that is probably one of the biggest causes of burnout or clinician distress or moral injury, however you want to put it, that many of us are struggling with at this time. And I think private practice at the end of the day works because of that autonomy that it affords physicians to shape their work life and therefore, by extension, their personal life and make it look the way they want it to. So I have really been trying to create solutions that may help reduce the barrier to entry into practice. And a lot of our younger colleagues are saddled with student debt as it is. And on top of that, to try and have to take out another loan in order to start a practice just seems way too daunting, way too risky. And it is so much, it makes so much sense that then they go towards the guaranteed salary that an employed position gives them. And that's what brought me to Link Medical Spaces. This is an online business I just launched, and it is the only online space of its kind specific for medical office space where one can list any available medical office space that you have, even if it's not the full suite and even if it is available only part-time, so that others who are looking for medical office space may find it. And the idea is, obviously, I'm coming from the point of view of somebody who was looking for space. And so it's ideal for someone who wants to work part-time or is just starting up or wants to keep things small for any reason, or even an established practice that is looking for a satellite location and will be at that location only only part-time. And on the other side, for those who have office space, it affords a bunch of advantages too. For one, even if they have space, it's expensive, whether they're renting or buying the space. And so you want to optimize it. So if there are 2 exam rooms at the end of the hallway filled with boxes, it's time to clean those out and make them usable. Next, it provides a passive revenue stream. And we all know that in this day and age, that is valuable. Third, it helps these practices maybe bring in a service that is a value add to their patients. For example, if you're a primary care practice and you bring in, say, a dietitian or a therapist or a physical therapist, maybe if you're a peds practice, maybe bring in a speech therapist who's there either a full-time or part-time, it's a win for everybody.
So you're doing both ends of the connecting, right? So you're having folks who maybe have space come to you and offer that on your platform, but then also folks who may be looking for space to come on and potentially place an ad, or how does it work today?
So it's really simple. The people who have space, whether it's a full suite or only part of an office, can list their space on the website for a nominal fee, which, by the way, is far less than real estate commissions or realtor commissions. On the other side, though, it is completely free of cost. So this way, you, as the lister or the owner of space, you are marketing directly or advertising directly to an audience, to your ideal audience, physicians and other healthcare workers who might need such space. But there is no cost to looking or browsing for spaces.
Got it. Okay. So super small nominal fee for the individuals who have the space, and free for the lookers who are trying to figure it out, with
That's
the
right.
intent of pulling it across the nation, or are you limiting it to certain geographies right now?
Oh, it's all over the country. So,
Awesome.
yeah.
Awesome. I mean, and that's what's going to allow, again, for folks who are trying to figure out, what does that sweet spot look like for me and how can I make that work? And I've seen a lot of docs really struggle with how to organize those arrangements, right? So if you're the main individual who leases the space, and maybe you even have the space, or as the staff, figuring out then how do you charge that for each of like your, sublease tenants. And so, there's no clear cut right or wrong answer to that. I know that there's probably better ways than others in order to do that, in terms of really looking at those fixed costs and then being able to pass that on a per day basis. So yeah, I
That's
mean,
right.
any thoughts on that, on what you've seen around that, or what you've seen be successful?
Absolutely. So I'm not an expert in this at all, but how I like to look at it is take the total cost of your space. Say I have a 5,000 square foot space that I rent out or I just bought and therefore have a mortgage on. And the total cost of the space is that mortgage plus anything else, the utilities, the cleaning supplies, often the internet, the access, and add it all up. And then if you think of the now if your office is going to be available only for say Monday through Friday, that makes what, 10 half days a week, and so you divide that cost by say 10, and that will give you the cost of your space, or what it is costing you per half day. Now if you are say a surgeon and you're not in the office on say Tuesdays and Thursdays, you're in the OR and you don't need that office and you want to sublet it on those 2 days, then you just multiply it by the number of half days that it's going to be and charge accordingly. So that's one way. Obviously, if it's going to be part of the space, then you prorate it for, if out of that 5,000 square foot, if it's a different situation, I'm an internist in an office and I potentially use only 3,000 square foot of it. I got a 5,000 square foot space because I wanted to grow into it. Then you just prorate for the 2,000 square foot that you're going to sublet. So something like that is a good
Yeah.
point to begin with, and then take it from there. It will depend on what other amenities you're providing your subletter stuff, but that's a starting point.
Right. Well, and again, it kind of comes back to our previous discussion where we're saying, like, it's an evolution. It's not what may be the situation today may be different tomorrow, right? You may not have mid-level support or a dietitian or somebody else on your team today, but tomorrow you may. And so being able to have some flexibility, that you don't create these really super long lease terms necessarily,
Mhm.
if you are anticipating changes, right? If you're just happy where you're at, you're like,
Absolutely.
I'm only going to work 2 days a week for the rest of my life, which would be lovely, by the way. I think we talked to you about how to figure that out. But it's that flexibility to say, like, here's
Yes.
a group of individuals who are coming together to say, what do you need? Is it shared staff? Is it shared supplies? Is it shared just a room? Is it what we talked about before we got on recording, was about even shared resources from a vendor perspective? And for our listeners, I think you guys all know we own a medical billing company, not RevMD, physician owned, and we really try and help practices of all sizes, but even ourselves working with the smaller practices, trying to figure out a win situation, because you want it to be affordable for the practice, but also at the same time, you recognize that there is a level of effort necessary to help a practice, regardless of how many individuals are there. But if you had multiple practices within an office, say maybe they are even on the same EMR practice management software, but still separate, still have their own TIN numbers, a third party vendor could help that one practice, even though it's made up of smaller practices, easier than, say, four separate practices and four separate offices and four separate office spaces. So I do think from a vendor's perspective, being able to organize that, we would be able to help at a much more affordable rate, I think, or a decreased rate for practices that had that sort of arrangement. So I think this is even a win for third-party vendors to be able to help docs in different size practices. That's just my thought.
I love it. I love it. And this is the dialogue we need to start having These are challenging times. And in times like this, we are a bunch of really smart, resourceful people, and the solutions are going to come from us. It's going to look creative, it's going to be innovative. Everybody is going to find their own little solutions until the big systemic changes come about. But that's how change starts. It starts as small drops that will then coalesce together and affect the entire ecosystem. So I love that you're thinking along these lines, and yeah, trying to figure out solutions, because I think at the end of the day, all we need, or the biggest thing we need, is a mindset shift from everyone, from all stakeholders, us physicians for sure, but even society at large, from patients. They are going to have to be okay with the fact that medicine, they don't have a choice really, that medicine is going to look different and feel different. Why maybe their nephrologist is in a shared workspace working by herself, or why their primary care physician also charges a membership fee apart from charging insurance, and all of these big and small changes. So yeah, change is here to stay, and we are the vanguard, and we are going to do it. We're going to find solutions.
I love it. I love it. Well, I'm excited for you. I know you're just kicking off the business, but I'm excited to help support this. I love the idea. And again, for our listeners, if you're out there, if you're trying to figure out, gosh, I need a space, or I've got somebody who's got a space, or anything to do with space. And again, I don't want to limit that to space. I think Dr. Mitra is sharing that this is more than just the physical space. I think it depends on what the arrangement needs to be, but this is really about sharing resources across healthcare individuals, diverse healthcare individuals, right? Not just physicians, but individuals who are going to be providing a service. And so how can we together share resources, whether it's front office staff, third-party vendors like a billing company or software or other things, down to office supplies that really help make it economical for individuals to be able to practice the way that they want. So I think this is a great idea. It increases revenue, which is our goal for all of our practices, while also kind of giving folks the flexibility that they need. So Dr. Mitra, where can they find you and your space if they have someone they know or they themselves are looking?
Absolutely. So the space website is linkmedicalspaces.com with an S at the end. And I am available by email at hello@linkmedicalspaces.com. I also write about my journey through lean practice and the lessons I've learned at leanprivatepracticesolutions.com. That's my blog. And it's just transitioning over from what it used to be. I started off with the personal finance basics. So that was the blog. And now it's leanprivatepracticesolutions.com. And you can write to me there as well at hello@Lean Private Practice Solutions. I spend way too much time on Facebook. So I'm there with my name, Sangamitra Sadhu. Yeah, so yeah, not hard to find me.
I like it. No, that's perfect. I think we all spend a little too much time, especially in these physician groups where we're all connecting and learning about each other. And I feel like it's less social at this point, and it's more networking, which I don't know, pros and cons, but I have enjoyed meeting you guys through those channels. So I'm excited for you. I'm excited to keep connected and hear how things are going, and maybe have you back on in 6 months and just kind of share some updates and things. So with that, I want to thank you for coming. And as always, if our listeners have any questions or concerns, you can email us at info@natrevmd. That's NATREVMD.com.
Awesome. Thank you so much, Dr. Heather, for having me on. It was truly a pleasure, and wish you luck with everything.
Okay. Thank you.